Welcome to the Occupational Health and Safety presentation, and we'll be discussing about the Health and Wellness Prevention Program presented by myself, ARIYIBI, ABIOLA, LYSA, ANYANWU, and Catherine MASALTA. What are we going to be talking about? We're going to be talking about health and wellness. What is health and wellness? A wellness program could be defined as any program designed to help and encourage employees to adopt a healthier lifestyle. So what kind of healthier lifestyle we're going to be discussing about in our presentation? Health promotion program from smoking cessation. What does this involve? Health promotion program for smoking cessation, approximately 5 to 10% of Americans have an addiction to alcohol, drugs, smoking, and the current norm is multiple substance abuse patterns. So in this presentation, we are going to be discussing how and some of the symptoms we are going to be talking about. And there's also a need to also focus on energy and discipline in repairing the damage by drug and smoking addiction to ensure recovery from most of these addiction. Therefore, there is a need to follow the wellness recovery program of action in order to ease smoking cessation. Now, let's analyze some of the health concern that is the focus of our health promotion program. The health concern that the program will focus on are relapses and dealing with withdrawal symptoms. Acute withdrawal from smoking is also associated with a wide range of uncomfortable symptoms. Cigarette withdrawal acute symptoms starts when the blood nicotine concentration alleviates sharply within 4 to 12 hours of withdrawal. And during this period also, it brings a lot of symptoms, which one of my colleagues is going to start and tell us much about these symptoms. Now over to Catherine, please.
Symptoms. The smoker can experience hand tremors, sweating combined with increased heart rate or tachycardia, vomiting and nausea, insomnia, the anxiety that is often followed by depression. Smoker graph. Percentage of smoker in the previous month, any mental illness total of 33.3%, age group 26 to 49 has the highest percentage, and the males outnumber females. The percentage of smoker in the previous month, no mental illness total of 20.7%, age group 18 to 25 has the highest percentage, and men are still more smokers. Percentage of lifetime daily smoker who smoked in the previous month, 61.6%, had any mental illness, 83.5% were between the age of 18 and 25, and 61.9% were men. Percentage of lifetime daily smokers who smoked in the previous month, no mental illness, 47.2% total, 81.8%, age group 18 to 25 highest, then men still on the lead smokers. The number of cigarettes smoked in the previous month, any mental illness, 326 in total, age group 50 or older has the highest average, and men continued to lead. The number of cigarettes smoked in the previous month, no mental illness, 284 total, while the 50 and older age group had 364 in average, followed by men with 299. Using wellness tools to help you through acute withdrawal and early recovery. Practicing relaxation and listening, deep breath, and other stress management techniques. Curb intake of sugar and caffeine to ease cravings. Using nutritional supplements during detoxification for vitalizing the body system and during the post-acute period of withdrawal. Engage in vigorous activities like fast walking and jogging for stimulation of endorphins production for giving free natural high. Normalize the sleeping patterns you had before by practicing self-hypnosis and bedtime. Use the wellness tools like meditation, exercise, and eating well that boost self-esteem and vitality during early recovery. Start focusing on the unique purpose you must live on the planet. The next.
Okay, here,
LYSA.
Thank you, Catherine. Here, I'm going to explain why a health concern is important to health promotion within a specific population. Health concern is important for smokers to ensure that the wellness program helps them to body detoxification. During smoking, the body is affected by the toxic chemicals in cigarette. There is also vital organ damage and risk of damage such as lungs, liver, heart, and other vital organs. Incorporating the wellness recovery program helps to elevate the risk of body organ damage while lengthening the lifespan. So here are some diseases that one is exposed to from smoking: chronic diseases, stroke, blindness, gum infection, and so on. So now I'm going to consider the factors that contribute to health disparities, and access to services. Education, employment, access to healthcare centers, and transportation options are among the socio-economic factors that affect the general health of the public. These are some strategies and measures proposal for smoking sensations, for smoking cessation. We have individual and group counseling intervention. We have stages of implementation, rapport formation stage, exploration stage, checklist, assessment stage, and then freedom from smoking is ranked as one of the most effective cessation programs in the country, and it has helped hundreds of thousands of people quit for good, and now is available in a variety of formats. My colleague Abiola is going to take over from here.
Thank you very much, LYSA. So myself and my group have been able to come together and talks about the cost and benefits this smoke cessation is going to cost individual company. And we come together with the direct, indirect, and the developmental cost. And the direct cost is about $100,000, which is $10,000 for each smokers. We're able to come about with 10 smokers. The indirect cost is $15,000 and the developmental cost is $25,000 for the 10 smokers, which comes to a total number of $140,000, because we have a lot of benefit for those employees. It increases the health, it increases their lifespan, it lowers the risk of chronic obstructive pulmonary diseases, it lowers the risk of cardiovascular diseases, and so many benefits that this is going to do. Well, we have a brief video that would have loved to play, but we can at the same time check this maybe some other time. It talks about over time, people who quit smoking, and we can check some of the benefits on YouTube. Thank you very much to my colleagues for the presentation.
Thank you.